which is really difficult is to find the patient in a very early stage, because many patients who have AA amyloidosis will be found or will be diagnosed very late in the course of their autoimmune disease, because usually patients have whatever disease, familial Mediterranean fever, some rheumatic disease like inflammatory bowel diseases or different kinds of arthritis, years before they develop amyloidosis. And as soon as they have been diagnosed for these underlying diseases, luckily we have sufficient therapy in many patients to prevent the development of amyloidosis. However, if patients do not know about their underlying diseases because they have like their childhood, since their childhood they have these attacks of familial Mediterranean fever, with abdominal pain and fever and pleural pain and whatever, and they just get used to that as a normal condition, but they never go to a specialist to find the diagnosis. Then they will come to us with the first diagnosis of amyloidosis, which could have been prevented for years, but as they didn't know about their disease, the first diagnosis is already amyloidosis, and that's kind of too late. So we would like to have to be able to prevent the patients in developing amyloidosis. This is the first unmet need, and the second unmet need, I think, is to understand, to further understand the mechanisms of AA amyloidosis, because the amyloid deposition in the organs, in AA amyloidosis, especially in the kidneys, has as consequence on the one hand a inflammation and amyloid deposition, which causes inflammatory reaction, but also a fibrotic reaction. And these two, the fibrotic and the inflammatory reaction, they seem to live independently next to each other, kind of. So, of course, inflammation has also an impact on fibrosis. However, even if the inflammation can be treated by whatever immunosuppressant drug, we still have these fibrosis, and this fibrosis seems not to respond well to our therapies, and we don't know right now which mechanisms lead to the formation of fibrosis, and why fibrosis will be developed even though the inflammation is treated well. So as soon as we have diagnosis, we should have the possibility to distinguish between these patients and to find some medications who can influence fibrosis, because generally in medicine, these fibrotic reactions in whatever disease are still a very difficult condition to treat, and I think it is in renal AA amyloidosis as well.